Next item I'm going to go over is the small volume nebulizer. There are multiple different types out there. Typically these will be run at 6 to 8 liters per minute. At 6 liters per minute you tend to provide therapeutic particle size. 8 liters per minute depending on the device you provide more therapeutic particle size, but if you go above 8 typically you're only decreasing the amount of time, not increasing the benefit to the patient. So therapeutic particle size, as a review, is 2 to 5 microns. Okay, these are what we call small volume nebulizers. These two are typically called acorn nebulizers because they look like little acorns. You run them at 6 to 8 liters per minute and the patient will breathe on them until they go to sputter. This is also a small volume nebulizer. It is called a breath actuated nebulizer. The brand name is AeroEclipse. The advantages of the breath actuated nebulizer is that no wasted medication, no exposure of medication to the therapist. You may think it's just a little albuterol. There are actually studies out there that are showing that respiratory therapists that have been in the field a long time may have pulmonary issues due to constant exposure to secondhand medications. With this, there are two ways of giving it. You see the dots, that is for breath actuated. If you twist it, that is for continuous, that is a solid triangle. So we want to give it, if at all possible, on breath actuated. It gives the patient the benefit. On breath actuated, it is a 5-minute treatment, and that is it. On the regular neb, you lose the benefit, of course, of breath actuated, and you're exposed to medication. Both of the acorns can be given via a mask if your patient cannot take a mouthpiece. The best way to take a breathing treatment is via mouthpiece. Most therapists may throw a mask on just because it's easier. The upper airway is to heat, humidify, and filter. Why are you going to give someone a mask to breathe their medication when one of the functions is to filter out particles? You're actually filtering out medication and not getting it to the lungs. Again, go with what your mentor says. Don't argue with them. You can ask questions about it, but a lot of therapists have their own thoughts, even though it's not based possibly in academics. So this one will go on the mask. Also, can you give the AeroEclipse on a mask? Yes, there is a special elbow that comes off, which we don't have right now, and it'll sit like that or like this, and the patient can breathe on the mask. So when you put this together, you need to put it together aseptically. Remember, every time you give a patient medication, you need to make sure that they know why they're taking the medication. Also, what are the benefits of the medication and possible side effects. Here I have the acorn neb. So I have my T-piece in here. And I can use the bag. I've already done hand hygiene and have my gloves on, but I can use the bag to do it. I just put the T-piece on. So here I can get the mouthpiece up. Remember, you never want to touch the mouthpiece because that's going in the patient's mouth. They don't want to put something where your hands have been. And then my 6-inch piece of corrugated tubing. 6-inch piece of corrugated tubing is 50 cc's. There we go. And then my oxygen tubing will go there. Now I'm going to open this up and see I can hold it without ever touching the mouthpiece. Open the medication. Squirt it in. I just squirted it in the top right there. Put the lid on. And what liter flow do we want to run this? That's right, 8 liters per minute, or 6 to 8 is the appropriate textbook answer. And here we have nebulization. So the patient would breathe on it. I'm not actually breathing on it, but they'll breathe. They'll put it in their mouth, breathe normally. And I like to advise them about every 4th breath, take a deep breath and hold it for a few seconds and let it out. That way they're getting the medication deep in their lungs, they're breathing on it and not going If patients tend to breathe very, very deep on it, they will typically hyperventilate. So that is the small volume nebulizer, the Acorn Neb. What I want to do is show you the breath actuated nebulizer. If you see, I'm still not touching the mouthpiece. And what I am going to do, oh, one thing I forgot to show you is with this device, the Acorn Neb, one of the advantages of the Acorn Neb is if the patient wants to take a break, typically their phone will ring, they want to take a phone call. They do not lose any medication. They can turn it upside down and they do not lose it. Pick it back up, keep going. That is the advantage. Disadvantage, wasted medication. It's nebulizing on inhalation and exhalation. Another disadvantage, you are getting exposed to secondhand albuterol. So when we go to the Aero Eclipse, so as you saw, I pulled it out like this. Squirt the medication in. Put that on. Go in. And I turn this up to 8. Now this is where you're going, but Dr. King, nothing's coming out. Well, no one's breathing in. It's on breath actuated. So when they breathe in, this little knob goes down. You don't have to push it. They can breathe in, and also they breathe out, and their exhaled breath goes through there. So it's a flap. Now, the one bad thing, or let's see, you go listen to it. You see the knob going up and down? That shows that it's nebulizing. I did not want to put my mouth on that. Okay, so it nebulizes. The good thing is I'm not being exposed to secondhand exposure here, and also I'm not wasting medication. The downside is it spills. So if this goes upside down, all your medication can go on the bed. That is a disadvantage of the Aero Eclipse. It is more expensive. A lot of hospitals apparently are going away from it because the therapist will not use it in breath actuated mode. They want to put the patient on a mask, and the patients want a mask so they can sleep through their treatment, which overall does not give a patient a very good treatment. If they're at night and wanting to sleep through their treatment because they're tired, they need to stay awakened. They have a right to refuse their treatment. Okay, small volume nebulizers, run them at 6 to 8 liters per minute. Advantages of the Acorn, you can turn it upside down and it will not spill. Disadvantage, secondhand exposure to albuterol or to inhaled medications. Also, continuous nebulization. Advantage of the Aero Eclipse, no secondhand exposure, nebulizes only on inhalation, 5-minute treatment, and the disadvantage is it does spill. These are small volume nebs. And they can all be given with the mask with the appropriate adapters. Mouthpiece is the best treatment, best way to give a nebulizer because of the filtration that occurs in the upper airway.